I'm delicate.
You?
Apparently.
You don't really scream delicate.
How much do you weigh?
How much do I weigh? 185?
Lightweight.
Yeah, exactly. All right, to warm up today, we're going to do 15 reps of Adam. Yeah, there you go. Good. Perfect.
That was beautiful.
It's my first day, too.
Oh my
gosh. Thank you.
Wow. You're good at that.
Stop it, you. No. Apparently, it really is my first day. Okay, relax. Whew. Pretty good, not so bad?
Pretty good.
Pretty good.
Pretty solid.
Way out. Good, relax. That was even bigger.
You're doing some good ones today.
Oh, I know what to do. It isn't my first day, actually.
I thought it was.
Shannon, good to see you again today. Thanks for coming in. So Shannon is probably one of the strongest people that I've run into at the gym that I go to, and she's going to be modest about it, but she can out deadlift me. I've seen it on her Instagram profile.
Oh my goodness.
But all the same, she's been dealing with a pain for, how many years have you been dealing with that, specifically the sciatica you were talking about?
No longer than a year.
Okay, so only a year. Okay.
Yeah,
Well, that's ideal. Okay, it's been a few months, but she's been dealing with a sciatic pain, and she's not quite sure what would have started it or how to get it better, but I'm going to let her talk about it for a bit. So Shannon, can you tell us a bit about the sciatica you're dealing with? Or?
Yeah, so I think mainly it's from bowling.
Okay.
Which sounds hilarious.
We were just talking about deadlifting, but it was bowling.
It was
bowling
that causes sciatica because it's a constant, really going deep into that hip, and I think that's the cause of it. But yeah, so just really funny. My husband and I and our two friends joined a bowling crew.
Okay, why not? Yeah.
Why not? It was kind of a joke, and it's become very serious now. So I got a bunch of bowling balls in the back of my car. I'm not kidding, anyways, it was a joke. Now it's become
I almost want you to bring one in just like as proof later. Like, we're not joking. This is what we do. Okay.
But anyways, so yeah, I went from, not bowling really at all to bowling nearly every day and just constantly putting that
same
deep
kind
stretch,
of hip rotation in there.
With like that hip flexion at the same time. And I'm pretty sure that's kind of what caused it and started it. And then since then, sometimes like things I do in the gym will agitate it a bit more, but I don't think it's like the main source of it,
So just out of curiosity, again, we're doing that hinging movement, the flexion and the hip internal rotation, makes me think piriformis off the bat. Are you aware of the piriformis muscle by chance?
Yes.
Okay, perfect. So that's one thing that immediately comes to my mind. We'll check that later. But what are the movements in the gym that kind of aggravate it then?
Sometimes squat or like hack squat, like when I'm really coming up.
When you really
deep,
get like
really
deep squat. Okay.
Sometimes I'll agitate it, but like only if it's already kind of pre-agitated, I feel like, or already bothering.
So you can
me
tell when it's kind of per finicky on it.
Yeah.
Okay. I don't think that's a word, but we're gonna roll with per finicky.
Okay. The other thing, I don't know, this might sound weird, but like,
go ahead.
So I bench with an arc.
Yeah.
Not a huge arc, but like I bench with an arc.
Of course.
And it puts like a lot of like, I guess, stress on that.
So you feel that down in the low back or the sciatic pain with that?
Kind of, I don't know, kind of the same spot. Yeah.
Okay.
Just in that one like pinched spot, I guess.
Okay.
But it's like I'll do my set and I can kind of feel it, but it's like when I rack it and then like coming out of that arch position, I have to go really slow if I
catches that.
Yeah.
Okay.
So if I like shoot up really fast, then sometimes I'll like, I don't know.
You'll
throw
aggravate it.
Yeah.
Okay.
Yeah.
Right.
So.
All right, so you've been dealing with that for a few months. It's obviously frustrating. Shannon and I talked a little bit off camera before she came in. You've been like exploring different options on like YouTube, like how to solve sciatica. Have you found much success with that? Maybe a little, maybe not. Like, I don't know.
No, I used to always stretch it all the time, and then I realized that's probably what caused it.
Maybe.
But it feels good though, so I don't really know. Like, it feels good when I stretch it.
So the thing that I always warn people, such as Shannon, who are in the position of developing some sort of symptom, in this case sciatica, is always be wary of what you're reading online and what you're viewing online, because sciatica is a symptom. Okay, it's not a diagnosis. So what that means is that sciatica can be caused by like 10 different things. Okay, and those 10 different things may respond better, or they may respond worse to whatever it is that you're doing. So it's good to get checked by somebody who knows, a physiotherapist, a chiropractor, a physiatrist, orthopedic surgeon, although you're not going to be getting in to see an orthopedic surgeon for this in Canada. But check with somebody who, you know, has made a career to check for these things. But good that you're here. Happy you're here.
Yeah, I'm happy you're
now, good. In addition to the sciatica that you've been dealing with, you're also mentioning that you get some catching or some tightness kind of in the thoracic region or the middle back. Can you tell us about that at all? Or?
Yeah. It's kind of like constant, I would say. Like
that's not like fun. Yeah.
It's like in and out of like worsening and
okay.
better, I guess. I find like rolling helps it, but dishes is the worst.
Dishes kind of leaning
forward. So when I have like my arms forward and I guess putting that stress on that part of my spine. Yeah, I don't know.
Hey, that's fine. That's enough.
Honestly, the biggest thing is dishes. Like I do all the dishes, which is fine, but like
it's okay.
Holding
it's
my
fine.
Arms
it's
out
okay.
is too much.
That's understandable.
I'll literally have to take a break from dishes just to go lay down and roll my back out.
Really?
Yeah, because I can't stand it.
So I know that you saw a chiropractor beforehand back when you lived in a different town, but have you seen anybody? Were they treating for this upper back pain, or like have you seen anybody for something that's getting in the way of your ADLs, your ability to do dishes, for example, or no?
So I still see her. She more deals with like my neck.
Okay, yeah. And we'll talk about the neck in a second there, but yeah.
And yeah, that's
we'll get there.
I got head to toe. Okay?
We got all afternoon. We got all the time we need. Yeah.
No, so she has been dealing with my neck mostly. And she does deal with my back too.
Yeah.
She uses something called Thumper. Do you know what Thumper is?
I have one.
Oh, you have Thumper. Yeah. I love Thumper.
You'll get Thumper. There'll be Thumper. Thumper is massage gun, guys. For you guys who don't know, but like some have two heads. There's a bunch of different ones, but there will be Thumper. Okay. Don't you worry.
Good. Okay, yeah. So she usually just Thumper, and then she'll do pads on my upper back, but not usually.
Are they like electrodes?
Yeah.
Yeah. Okay. Yeah. So TENS unit, trans-electrical cutaneous. I can't remember right now, but anyways.
Pads.
Pads. TENS. That's what it's referred to, or IFC, one or the other. Yeah.
But yeah, other than like Thumper, she doesn't really like. It's just mostly my neck and like other stuff.
Okay. So this upper back has kind of gone a little unaddressed. Maybe she saw to it. Maybe she didn't. Doesn't really matter. But I'm just curious as to what's been done. And if you've responded well to anything in particular beforehand. Like, I'm glad that Thumper obviously feels good, but does it seem to take you out of pain for a significant period of time?
I would say probably not.
Okay, yeah. No. So it usually doesn't. Okay, like Thumper and massage gun, like I do it on pretty much every patient in here, but it's not for the purpose of actually taking the pain away. It just makes them feel really good in the moment. Okay, and that in itself can lead to positive experiences for them. The actual healing process, the actual fixing process comes largely from activity that you're going to be doing yourself afterwards. Okay, and in addition to here, we're here to give you that boot, that jump start to get started with that, right? So we'll see to the upper back, no problem. You said that there's stuff to unpack about the neck. Do you have like a history of trauma, or like what's going on there?
I don't think I have a history of trauma. Like, I've had concussions from whipping my neck.
That's trauma, technically, but like,
it's more my head, though.
Well, your head, believe it or not, is attached to the neck.
Yeah.
So when you move it too much, sometimes you can strain the neck. Yeah. Just
no, I'm definitely
science.
Like, even a couple times, like I'm not gonna demonstrate for you and have a live demonstration.
That's okay. That's
just turned my head really quick just to look at something, and then all of a sudden
something
I just
tweaks.
Throw my neck out, and then I can't look to the left for a week or a couple days, right?
All right. Is there one side that happens to more often, or is
left
it left side?
Sure.
Is definitely yours.
Yeah.
You also mentioned that like when your previous chiro would palpate in, or palpate means to touch with intent, right? So feeling through the neck, you get that kind of referral pattern into the forehead. Like you can feel that throughout your head.
All the way up.
Yeah. Okay. Very textbook, very common. We can see to that here as well. Okay. That's kind of what we're dealing with. We're dealing with full back as far as I know. At least that's what we talked about beforehand. Is there anything else that you want to talk about here? You want to get checked out today, or?
I mean, if we got the time.
No, you know what? We can talk.
Check out everything. I'm just kidding. My hip, though, like inner hip, I think it's like hip flexor, kind of. I don't even know. Like sometimes. Let me backtrack. Let me backtrack for a second. I'll get ahead of myself. So, I think when I first started really getting into deadlifting, I kept pinching the
hip flexor region,
yeah.
psoas.
Yeah. And they were really bugging me, both my hips. But that resolved itself, it went away. But then more recently, which it's been, I don't know, at least 6 to 8 months since it's felt resolved and not been bugging me, this one started acting up again.
When did it start again? How many weeks ago? Or how many days ago? Or when?
That's a really good question.
I'm basically looking for recent, or has it been months?
Not months.
Okay.
I'd say max a month.
Okay, good. So still like in the subacute
actually probably
stages.
around a month.
Perfect.
Yeah.
Okay. All right. So very often the sciatic pain, the piriformis and the low back and the hip, they're all interconnected. Okay, so like if you have an issue with one, you'll get irregular movement patterns in the other that you will not be aware of. Okay, you just won't be because your body is just moving as it can to its best ability. That can then lead to spiraling of other issues as well. All right, we see a similar relationship with the neck, the shoulder, and the upper back. It's the same with the hip, the lower back, and kind of the glute region. So absolutely, we're going to be screening your hip anyways, given what you've told me beforehand. So we'll see to that too. Okay. All right. So what we're going to do today then is we're going to get into the physical exam next, and then we're going to figure out what the best method. Email, that's me, not you guys. We're going to figure out the best method to help you out. Okay.
Okay.
So as we just went through the history with Shannon, we're doing everything basically head to toe. So we're going to start with the head, because why not? So I'm going to get you to face forward for me. Thank you. We're going to start off with the classic C-spine range of motion. So I'm going to get you to bring your chin down to your chest for me. Does that provoke any of the discomfort either up here? I know you said the left side is worse for you. Anything down into the traps or the middle back? No? Okay, now what if I do something kind of mean and actually push it further? Better, worse, or the same?
The same. It just feels like a nice stretch.
It feels like a good stretch.
Yeah.
That's good. So better, actually. Get you to come back up to neutral. Now I'm going to get you to look up towards the ceiling, please.
Yeah, this one's not nice.
That one's not fun. So she doesn't like the extension aspect of the C-spine. If I go ahead and pull that even further, that's even worse probably.
Yeah.
All right, face forward. Oh, sorry about that. All right. Can you get you to rotate your head as far as you can to the right, please? We can get to about 55, 60 degrees. All right, now as far as you can to the left. We get to about 60 degrees. Okay, so we're equal bilaterally in rotation. That's really good. Get you to bring your right ear down your right shoulder, please. I got to get low. We can get to about 50. Now left to left. 50. Okay, so it's really that extension aspect that bothers her the most. The rotational and lateral flexion ability is present and equal bilaterally, which is pretty actually rare in the patients we see here. Usually there's a notable asymmetry. So good job.
Thanks.
That's me again, guys, not you. All right, I'll get you to give yourself a tight hug. You've probably earned it. Really tight hug. And then I'm going to get you to rotate as far as you can to the left for me, please. As far as you can. Okay, so here we've got a little bit of reduced mobility. We get to about 30 degrees. Now let's go to the right as far as we can. Okay, we got significantly more going to the right as compared to the left in this case. Here we can get to about 50. Other side is 30, so there's an asymmetry. We can take a further look at that with our palpating later. You can relax. Last thing, I'm going to get you to stand up for me, please. And now I'm going to get you to test that lumbar flexion. Bend down, touch your toes for me. Does that bother anything in the sciatic or the low back at all?
No.
No? Awesome. Now come back up for me. Now we're going to go the other way. Instead of bending forward, we're going to bend backward like this. Okay. She already doesn't like that.
I don't want to do that.
So, is this an aggravating movement for
Yes.
you? Yeah. Okay. So actually, do that one more time. I'm just going to observe you from more like the side over here. Go ahead.
Straight back.
Just straight back for me. Okay, so one thing that I'm noticing immediately, and you guys might be able to see too. Actually, I'm going to move the camera so that y'all can see this. Go ahead one more time for us, please.
Gotcha.
Perfect. Okay, so a lot of her extension ability is actually coming from her upper back.
Yeah,
okay.
you feel that.
Yeah, instead of her low back. Last time, I promise. Last time. Okay. The low back stays pretty straight. The upper back bends backward crazy. So we see that very often in patients who are lumbar extension intolerant, which is definitely something to take a look at with the adjusting in a moment. Thank you for doing that like 5 times. That was terrible.
I'm like, don't seize up.
I get you to start by bringing your arms up for me. Good, just keep them both there. Don't let me move them. Good, nice and strong. Good, nice and strong. Bring your arms forward and curl the wrists backward, please. Actually, I'm just going to get you to bring, yep, so there in camera, perfect. And that's strong. That's strong. Good, turn over, curl the wrists inward. Strong. Strong, awesome. I'm going to get you to now fingers curled, keep them strong. Now, you said you have a bit of a tendonitis in one of the wrists too, also from bowling, surprising probably nobody. And which wrist was that?
This one.
This
Well, it's
one.
like right there.
Okay, so it's more on the back aspect then. Okay. But that didn't get in the way of your curling then, did it? Like, no, you actually still feel quite strong there. Good. On this side. Good. Turn over, fingers straight. Please gently squeeze mine. Thank you. I always have to say gentle because one guy nearly broke my fingers. That was not a good time. Yeah. I need these to make money. So drop. Good.
Oh, lovely.
Reflexes are just fine. Drop that arm for me. Good. One more. There we go. Okay, and what happened here?
Yeah, that's the story. Actually filled it out in your intake form.
I will read through that before I do treatment. Yes.
Surgery, though.
Surgery. What was that for, though? If you can fill us in for the camera.
Yeah, so I had a whole bunch of glass stitched up into my finger.
Stitched up into your finger?
Yeah. So there was shattered glass that, like, embedded into my finger.
Oh my god.
And I hit an artery. Long story short, I hit an artery, spewing blood everywhere.
Yeah,
whatever.
that's an emergency.
I knew that I needed stitches.
Well,
come on.
She's here. She made it. Okay, that's good. All right, so upper limb neuro is normal despite the surgery and all of that. So good news. There you go. So sciatica. What is sciatica? It's sciatic nerve pain. Because it's a nerve pain, it's important to do a neurological exam for, well, specifically the lower limb. I also like to do the upper limb with pretty much all of my patients just to be comprehensive. So, all right, starting here, I'm going to go ahead, and we got decreased reflexes there. Take a look. But equal bilaterally, therefore I'm not super concerned. Drop the foot. Good. Good. Good.
Oh.
Yeah, people don't like this one.
No, that one's not nice.
Yeah, it's not nice, but that's the one that checks for the important stuff, believe it or not.
Okay.
So, all right, go ahead, push your foot up into my hand. Push your foot up into my hand. Good. Lift the toes up, please. Lift the toes up, please. All right, good. So equal bilaterally, a little bit decreased on the patellar reflex here, but otherwise unremarkable and normal. That's the way that we like things. How do I do this with the camera? Normal. Normal. There we go. So we have the extension intolerance, all right, on both sides, right? But we're getting that sciatic pain on the left side, which is the side close to me, guys, just so that y'all know. We're still going to check out both sides. Obviously, you want to make the comparison, right? So let's actually start with the right. I'm going to start with the very classic straight leg raise. I'm going to take this, I'm going to lift it straight up as far as it will go, okay? Now, we can get to the 90 degrees. That's really good. Any aggravation of any discomfort in the low back or that sciatic on the other side? No? Awesome. I'm going to get you to slowly lower this down yourself. And that's all okay? Perfect.
I think so.
She's not sure, but we're going to go with that's okay. All right? So let's go ahead. We're going to do this other one. I'm going to bring this straight up. Is that okay for you?
Yeah.
Nice. Okay, now slowly lower down, please. She's like looking around. It's like, is it supposed to hurt? Not necessarily. Okay, but if it does, that tells me something. But if it doesn't, then we're okay as well. But that's okay both sides, it seems? Perfect. Love that. I'm going to bend this knee. And take my hand. I'm going to place it behind your thigh. Okay? And from here, I'm going to push through. That's all good. Yep, that's good. As judged by her neutral expression.
I did hip abductors the other day, and I haven't done them in so long, so my glute,
probably
the upper one, is so sore, so I'm trying to ignore
Is it DOMS or is it like an actual positive test?
Yeah,
okay.
you know.
So we're going to bring this up. So I'm going to place right thereabouts and pushing that way. Anything?
Maybe like my hip's a little bump.
Maybe in through the hip.
Inside.
All right, let's go ahead and do a range of motion for that hip then. From here, we're going to bring up. First thing we're going to do is internal rotation, which there's not much. We can get to about 10, maybe 15 degrees of right-sided internal rotation. Does that provoke any kind of pinching? Yeah, in there.
Yeah.
Okay, what if we go the other way? We're going to do external rotation now. That's okay?
It still hurts a bit.
Does it pull in that adductor group?
No, more just
all kind of in the hip area proper.
Yeah.
Okay. So we're going to compare that to the other side here. Bring it up to the 90. It rotates. Okay. So on this side, we can get to about 40 degrees of internal rotation, not quite 45, but that's a pretty significant asymmetry. Do you get any knee pain on this side out of curiosity? You do? Okay. On this side? Yeah.
Oh, on the outside?
Yeah. Or, no, sorry, like the left leg.
Yes.
Yes, okay.
Yeah.
Any other right? Like, if you have to think about it that long, you
yeah,
probably
but not
don't.
significantly like my left one.
Okay.
Yeah.
The reason I ask is because, and I actually talked about this with the patient who was just in before you. I'm going to have a seat right here, okay? Is the knee can very often absorb forces that are created due to an insignificant range of motion in the hip or the ankle. Okay, so in this case, there's a notable asymmetry. Her right side has about 40 degrees of internal rotation. Your left only had 15. Okay, so anytime I see that asymmetry, that tells me that you probably should actually have 40 degrees on this side too. So I'm going to show you a movement later that'll help open up that hip specifically to get the internal rotation back. And it's my belief that that should calm down the knee discomfort that you're getting, as well as help to open up with that hip impingement that you're dealing with. Okay, that kind of like the pinching of the psoas or whatever hip flexors in there. On that note, let's check the hip flexor. I'm going to bend this knee. Okay, I'm going to come back around here. Now, y'all are familiar with the psoas by now. Do you know the psoas muscle? Mm-hmm. Perfect. I love it when patients have like an anatomy background or knowledge on them, because that makes communication a lot easier.
Absolutely.
But to feel the psoas, I need to find that bony little protuberance.
I'm so ticklish here.
This is going to be great.
It's going to be terrible.
Did you just snort? Did you just snort already? No. Okay, I was like, guys, give me a break.
That was my mouth.
That was my mouth. All right. So I'm going to find this bony protuberance. Yeah. I need you to just turn your face to face the window, please. Perfect. Take a big breath in for me. And a big breath all the way out. And I'm going to sink my thumbs in as you exhale. One more big breath in. And all the way out. Sink my thumbs in one more time as you exhale. Good. All right. Now from this position, I'm going to get you to keep this leg straight, but lift it up about 5 inches off the table. Now, how does that feel? Is that quite tender in there?
Yeah.
Yeah, okay. So that's one location. Lower it down. We're going to poke a different location on the same muscle, the psoas still, that is usually more sensitive. If this one's more sensitive, I'm telling you there's definitely some psoas hypertonicity. Okay, so she's all... Is that ticklishness? Or is
so ticklish.
Okay.
Like, it's not even funny.
Brace yourself.
Yep.
Big breath in. All the way out. And in. All the way out. And go ahead, lift up.
Yeah, that's... very painful.
That's very painful. Okay, so we've definitely got some hypertonicity or some tension in that psoas. Is the psoas causing the decrease in the hip rotation? I don't know, maybe. Is the hip rotation causing the tension in the psoas? I don't know, maybe. Or the lack thereof hip rotation. Doesn't really matter which came first, the chicken or the egg, if we hit them both. All right, so that's kind of my approach to things here, and I think that's going to help you out on this side. Which again, coincidentally, is the side of the sciatica. So maybe that's playing a role too. Mm-hmm. Next up, we're actually going to get you to lay face down, okay?
I've actually had a significant amount of like injuries on my left leg side, so I've babied this leg a lot, I feel like.
So when you say baby, you mean like you're cautious about moving it probably?
Yeah, like I broke this foot where like I'm not walking on it. I've had surgery on this foot where wasn't able to use this foot for like a year. Mm-hmm.
Okay, so with that too, that's going to contribute also into the knee pain if you're getting irregularities in your ankle stability and whatnot. Yeah. So it's all kind of fitting together nicely with the medical history here. Okay, so as we've discovered, or not discovered, as we talked about, it's that left side sciatica that we're getting discomfort, but we're also dealing with tightness up in the upper back too. So right now we're going to go through and actually feel through with intent. We're going to palpate, see what we can do. We're going to start with those SI joints down here, okay? The sacrum and the ilium form the SI joints, as you guys are very familiar with. So hands are going on the low back here. I'm going to press through there. Is that okay?
Yeah, it's a little sore.
It's a little sore. Okay, we're going to... Oh, right, you said, but the upper glutes are quite sore right now.
Yeah, it might be that.
Okay.
I don't know.
I'm going to try to avoid those and really focus on the SI joint itself. Actually, I'm just using my fingers then. Does that provoke anything at all, or are we okay there?
That's okay.
That's okay. But then again, how's that over there? That's okay?
Yeah, it's not bad. Okay,
so more so the SI joints are okay. It's the glutes that are sore. Now, working through the low back itself... We got, especially as we get up towards the TL junction. Is that the spot that you usually get a lot of issues with?
Yeah.
Okay. So this is the TL junction, which you guys are probably aware of, but I'll explain to you if you don't know what that is. The TL junction is where the thoracic spine, the upper back, becomes the lumbar spine, the lower back. It's a transitional zone. Okay, and every time we get a transitional zone, whether that's in the TL junction or the CT junction up here where the neck becomes the upper back, we get some pretty unique anatomy designed to absorb all the shearing forces of the opposite directional movements responsible from the different segments of the spine. So what that means is that these are very common areas of tightness in people, and in your case, that definitely seems to be what's happening. So I'm going to stretch that out just a bit here. I'm also going to fall silent because sometimes people release when I do this. So, wow, okay, that's on. That is. I want you to try
I'm trying not to because you're like.
Oh yeah. Okay. So sorry. I'm gonna place my hand on the front of your hip here. Sure. Yeah. Okay, and I'm gonna press through here. like that. Is that okay?
Mm-hmm.
Perfect.
That's painful.
That's painful there. Okay.
Like on my low back. Yeah.
On the low back. All right. Freebie. And do the same thing on this side. Is it at all painful over here or not really?
Yeah.
It is too? Okay.
But like in the, like right here.
It's all, so it is all at the base of that sacrum.
Yeah.
So it's really that L5 S1 transition. How does it feel when I kind of splay here? Is that painful or does it feel relieving or anything?
No, it doesn't hurt.
Doesn't hurt? Okay.
I don't know if it's relieving. But
Okay. Just kind of neutral.
yeah.
All right, working our way up. Okay, so I'm going to attempt to adjust you here up through kind of the middle back area. Okay. So the way, you've been adjusted before, yeah? Perfect. So the way that I tell people is that it's never really possible to know how much force is needed in order to get a person to go the first time.
Mm-hmm.
Okay, like I've had 350-pound guys on here. I could sneeze on them, they'd release. I've had 100-pound like ballerinas on here, and I've had to all but body slam them. Okay, so with you, I'm going to start quite light, and then we're going to add a little bit of force if we need a bit more force. Okay. So I'm going to need you to take a big breath in for me, and then all the way out, please. Good. Perfect.
That was beautiful.
Oh, thanks.
You did a good job.
Ah, it's my first day too.
Oh my gosh.
Thank you.
Wow.
It's not my first day. It's not my first day. Okay, breath in, all the way out. Woo!
You're good at that.
Stop it, you.
First day on the job.
You're making me blush. All right. Good stuff. Try for one more up here. I'm just going to turn your head, okay? No. Okay. Apparently it really is my first day.
Yeah, that one wasn't so great.
That's okay. I'm sure the next couple will be good. As Shannon was telling us beforehand, with that bowling movement, that seems to be the original thing that onset the sciatic pain going down the back of the leg. With that movement, we are getting stretching of the piriformis, which is a deeper glute muscle located between the sacrum and the hip greater trochanter, which is out here. So Shannon, what I'm going to do here with your permission is I'm going to dig into that piriformis, see if that provokes any of the sciatic complaint. Is that okay with you?
Yeah, that's
Perfect.
going to hurt, but yeah.
Oh, it's gonna suck. It's going to absolutely suck.
Yeah.
Just give me the heads up for that. Typically, it's a good idea to get patient consent before you go digging through their glutes.
Yeah.
So, yeah. All right, so I'm going to press in through there, and what I'm going to do here is bend the knee and rotate it outward. You let me know if you get any aggravation of that primary complaint at all. Are you okay?
Yeah.
That's good. Still okay?
Yeah.
Awesome. Okay. Let's just compare that to the other side. I assume that there's going to be nothing on that side. Why would there be? We haven't had a history of sciatica. And relax this. That's all okay too?
Yep.
Love it. Okay. Okay, so with the piriformis being pretty clean, I dug pretty hard in there. There wasn't any aggravation, even after moving it across my pin of the thumb. I'm really coming back to either this low back stiffness here or the hip issue that we're having in the front. So those are going to be my kind of primary concerns going forward rather than the piriformis itself. Again, with the bowling, we are still getting a lot of that internal rotation at the hip. If that's not sufficient, you're going to get a whole bunch of other movements going incorrectly, which can contribute to that sciatic pain. I'm going to bring this up. Also, I'm going to scooch the hips closer to me, please. Thank you. Good. And we're just going to relax this hip as much as you can. And I'm going to take this and relax the upper body as much as you can. Perfect. So what I need from you is I'm going to get you to take a big breath in, and then all the way out, fast. Nice, good, relax. Whew. Pretty good, not so bad?
Pretty good.
Pretty good.
Pretty solid.
See, the next one was better, I told you. All right, we'll get you on the other side.
I thought so.
We're going to bring this leg up. Nice. We're going to relax that. I'm going to take this. Big breath in once again. All the way out. Good. Relax. That was even bigger.
You're doing some good ones today.
Oh, I know what to do. It isn't my first day, actually.
I thought it was.
Rude.
Hey, I'm just going by your word.
It's true. I started it.
Yeah.
So Shannon has, definitely that upper left aspect, before I even actually get into the preamble. But Shannon has been seeing a different another chiro back before she moved to town for her neck complaint, because she has the history of, do you get headaches too, or is it really just, okay, she got a history of headaches and a neck complaint specific to that upper C-spine area. So you guys can see where my finger is. It's at the base of the skull, pressing in there. Does that cause any of that referral? Yeah, okay, so you're feeling it right now, okay.
Yeah.
I appreciate your effort in not wanting to strike me in poking through here.
Oh, no, I love it.
Oh, okay, good.
I love it. I find it so relaxing. It hurts, but it's a good pain.
Oh, it hurts good, right?
Yeah.
Definitely that left side and lower down too, kind of the whole left side.
Yeah.
Actually, did you do something to strain it recently, or is that always you?
It was recent-ish. I don't know, maybe actually not that recent. Maybe 3 months ago I did when I turned my head.
Oh right, you mentioned.
But then it went away and then it came back and then it went away and then it came back.
How's this side feel in comparison? Because it doesn't feel too great to me either. It feels better lower down, but
it hurts, but it is better than the other side.
Okay. So you've had your neck adjusted before?
Yes.
Awesome. You know what to expect then.
Yes.
It's nothing worse than having actually that's a lie. I coach patients through their first time all the time. It's actually a good time. But I'll get you to relax that head for me. Good. So from this position.
Oh, I've never had it done like that.
How have you had it done before?
Well, same, but more this way.
Oh, more of a tilt.
More up, yeah, I guess.
Every chiro is a little bit different, right? That's why it's hard to standardize this, because they're all different manual techniques. Right. But hey, there are different ways to hammer a nail.
There you go. Wow.
1, 2.
Okay.
Yeah. I could tell there was more there. So.
I did not expect that second one.
Okay, let's do some more triggers. You're ready to fall asleep.
Mm-hmm.
Yeah.
This is always my favorite part, is getting my neck.
Your neck pulled?
No, just neck in general.
Fair.
Because headaches are terrible.
Oh yeah.
And just having that relaxation in your head and neck is just.
So this has helped you before in the past, huh?
Yeah.
Getting your neck worked on?
Yeah.
I'm the same way. I get bad headaches too.
love it. I'm don't let it stop.
Glad to meet you. Yeah.
Yeah.
All right, let's get you face down next. Okay. Shannon, beforehand, we've worked on her fascia with instrument-assisted soft tissue therapy, and she's gotten quite red with it before. We could expect that again, maybe to slightly less of a degree, but with the history of tightness throughout kind of the upper middle back as well as the low back down to the sacrum, makes sense to kind of just do this full spine, even up into the neck area as well. So let's get started with that. So Shannon has a really cool hustle that she does, and we follow each other on Instagram. But Shannon, would you want to talk about what it is Heart and Soul? I believe it's Heart and Souls.
Yes,
Is that it?
yeah.
Heart and Souls does?
Yeah, so I'm a custom shoe artist. I've been an artist actually my whole life.
Cool.
During the beginning of COVID, I had nothing to do with myself, obviously.
Just like everybody else.
Nobody had anything to do with themselves. And one of my really good friends messaged me, and he's like, hey, like, if I get you everything that you need, like, all the supplies, I'll buy you shoes, I'll buy myself shoes, and I'll pay you for it. He's like, can you customize me shoes? So I'm like, well, duh.
Good to know that Serb was well used by him.
Yeah,
That's perfect to know, to start your business.
Yeah, exactly.
That's great.
Well, yeah, it wasn't the plan originally, but I had nothing else to do, and so customized shoes for him, and then I had all this leftover supplies, obviously, so I'm like, well, I might as well just keep doing it, right?
And you obviously ended up enjoying it.
Yeah.
Good.
And it wasn't even, I didn't start it to start a business, it just kind of happened, to be honest with you.
The best businesses are the ones that are built by accident.
Yeah.
Really?
Yeah, really.
Mm.
Yeah, so that's what I do now. And
that's really cool. I like that.
anything you want on a shoe, you can have it.
You want me to link your Instagram in the description down below? We can do that if you want to get some engagement. There you go.
Link down below.
Link down below in the description, guys. Check out her artwork. It's way better than mine.
Oh, thank you.
Not that I have any artwork to compare, but, you know, that's why it's better than mine, because I have none.
Everybody's go-to phrase whenever I talk about, or we're talking about art is, I can't even draw a stick man. That's like everybody's go-to phrase.
I draw a killer stick man.
Okay,
yeah,
you're
like
different
my
then.
stick men are. I will actually fight people on that point. My stick men are solid.
Probably
But
better
you want
than
anything
mine.
else? Then no, not a chance.
That's hilarious. What is it you're using right now?
So this is the instrument-assisted soft tissue therapy, the tools, but I like to use an oil on it because, namely, if you don't use the oil, it just hurts. Like it does not feel good at all, right? So.
But it's not the bar, is it?
No, that was my warm-up tool. That was the shark.
Okay, because I was
here,
like, that.
Here comes the bar.
Yeah, here we go.
She's like, this doesn't
Here's the
feel
painful
bad.
part.
When does this start to suck?
Yeah.
Like, oh, right now.
Okay,
Yeah.
great.
Mm-hmm.
We love that.
Don't you worry. I'm here to bruise.
As long as it's safe, you can
It is
bruise
safe.
me all you
Yes.
want. But don't abuse me.
It's therapeutic bruising. Yeah. Mm-hmm. And already we've got quite a bit forming in this area.
That's
So.
crazy. It wasn't even that much.
No, it was not.
I'm delicate,
You?
apparently.
You don't really scream delicate.
Oh.
Something about you. Again, maybe it's the fact that you could literally pick me up, but I don't know. You don't scream delicate.
How much do you weigh?
How much do I weigh? 185?
Lightweight.
Yeah, exactly. I'm probably your warm-up set, not even. Yeah.
Yeah, basically.
All right, to warm up today, we're going to do 15 reps of Adam. Yeah, there you go.
Oh, it's funny. How do you deal with, I'm sure your hands get so tired or uncomfortable.
My hands, so I have been, like I had a Game Boy in my hands before I even knew how to read or write. So I have been training my hands for this unintentionally since the age of 3.
That's hilarious.
So, believe me, my hands do not get tired.
Really?
Yeah.
They don't get sore?
No.
Interesting.
Yeah, but it's because I've been literally mashing and using them consistently for every waking. So people who don't know on the channel, I'm actually a massive gamer. If you look at my banner, you'll find a PlayStation controller if you look closely enough. But I am a massive gamer, and I have been doing that since probably shortly after being able to walk. That's why, like my hands, I have been using them intensely gripping since then, because, you know, I really had a big thing for trying. I thought if you press the buttons harder, you'd be more likely to catch the Pokemon, right? So that was my little brain at work. And since then, we're okay. Yeah. I wonder if Nintendo will cancel me because I said Pokemon now.
That's hilarious.
Doesn't matter.
The, like, itching sensation you get, does that have to do with, like, the fascia?
Yes.
Okay, I figured.
Some people can feel a little bit itchy in doing this, as if I'm
Yeah.
like getting at a scratch or something.
Yeah.
That's pretty normal. Everybody responds to this differently.
It's like a
right?
tingly itchy.
Yeah,
Not
yeah,
a good itchy.
No. So with tingling, though, it could also just be increasing the blood flow to
Right,
the area.
right.
Okay, like this, what this does, like this actual redness, it is by definition a microbleed. I'm not joking when I'm saying
Yeah.
I'm bruising you. That's what's really happening.
Yeah, no,
but it's
no.
safe. Like, it's not dangerous in any
No,
sense,
no,
right?
right.
Unless you have a chronic, severe history of kidney disease, you're
Yeah.
okay, right? So
No, it'd be similar to, like, how cupping,
exactly,
brings on
it's
the
the
blood
exact
there.
same mechanism.
Yeah.
It's the exact same mechanism.
which I've had that done before.
Accidentally hit the mic, but that's okay.
Actually, something you might not know about me.
Tell me.
Actually, I'd be surprised if you knew this about me, and that would be weird. I used to be really into polar dips.
Polar dips? Like polar bear dips?
Like, in the middle of winter and negative 30 degrees, I'd go dig a hole in the river,
Yeah.
the ice, and sit in it.
So I've known you for about a month.
Yeah.
I don't know you back when you were polar dipping,
No.
FYI, so you can wave that concern away. But like, yeah, okay, interesting. Was there a reason? Do you just hate being warm? Is that it? Like, what's the problem? Like,
That's hilarious. So actually, it also kind of started during COVID. There's a lot of stuff that started during COVID. Okay. COVID was a rough time, people.
clearly.
I actually started it, well, I don't even know. You know, that's a good question. One of my friends posted a video of him doing it, and it was his first time doing it. And I was like,
Oh yeah, well if all your
Whoa.
friends jumped off a bridge, would you?
no, but I thought it was
okay.
just super fascinating. And I was like, that is so cool. I want to try that. He's like, come. I'm like, okay, bet. So, just went and did it.
I'll be there. When and where?
And believe it or not, it is very addicting.
So I have done a cold plunge and a sauna before, like you jump between the two. And one of the tubs was 3 degrees, the other tub was 6 degrees. I did the 6 degrees. If anybody hasn't done cold plunging that's watching this on the channel, it feels like your skin is simultaneously peeling off and shrinking down onto your bone. And I don't know how those two sensations can exist at the same time, but let me tell you, I absolutely hated it. But if you liked it, that's good. But
So-
you know, again, I'm a delicate flower.
3 degrees is actually very, very cold. I'm surprised because usually they keep those kind of tubs a little warmer than that. But I would do it in the middle of winter, so it's very much 0 degrees.
Yes, see, no. That's
basically ice.
Mm.
So it's
That is ice. That is the turning point. Like,
Yeah, it's a little different sensation because for me it was more just your skin would just go numb, basically.
I'm just gonna roll this up if at all possible a little bit. Okay, there you go. Good.
Your skin would just go numb,
See,
like
I
so you don't feel anything.
that doesn't feel great to me. I don't like not having sensation. So
No, and honestly, while you're in there, it's awful. It's terrible.
Oh yeah.
It's not fun. But when you get out, you get literally a high. Like it's,
Oh, yeah,
it's
no,
a whole different.
I had the
feeling.
best sleep of my life later
Oh,
that
yeah.
day. I felt
Yeah.
more exhausted than having some of my best workouts ever. But it was just yeah, I wouldn't recommend to myself again. But some people, don't knock it till you try it. Give it a try. See what happens.
Just do it safely, please.
Oh yeah, no, go with a friend.
Yeah, don't jump in a river like me.
That's what the hell are you doing,
No,
Shannon?
that was very dangerous.
Yeah,
but
clearly.
That already feels better.
I hope so.
Like, usually if you did that to me, like, I would be
you'd cry.
twitching.
Yeah.
I would be tweaking because I couldn't stand it.
It's my job to make these pains decrease, you see.
Yeah, you do a good job.
Thanks.
That's painful.
Right in there.
Oh, yeah. That's terrible.
Will allow me to press on it harder.
Oh, yeah, absolutely.
Okay?
Yep.
You're good. All right, so you're quite red once again, surprising probably nobody, but just so that you're aware.
Okay. Actually didn't hurt as bad that time though.
Good. We're building up some tolerance to it.
Yeah.
That's good. So lastly, we're going to work up in through the traps and the left scap here on Shannon. We're going to get you to look up and to the right to start for me, please. Actually, no, up and to the left, my bad, because the left side's worse for you. And then up. Nice. All right. And I'm going to take a pointy elbow. I'm going to put it right there. I'm going to get you to look down and to the right towards the microphone down there, okay? Ooh, hi. Okay, wow, that's a rope. Okay. Come back up to the left for me. And down to the right. Swear I'm not trying to do that. That's just up and to left, slowly down and to right. Good. Once again, please. Go ahead. And again. Awesome. Please face forward. Tilt your left ear to your left shoulder. And right ear to right shoulder slowly. Good. Left to left. Right to right. Ooh.
Yeah, that's sore.
Left to left. Right to right. And left to left. Right to right. Good stuff. I'm going to get you to look up and to the right now, please. Same deal on this side. We're going to look down and to the left now. Please go ahead. Good. Up to right. Down. Ooh, down to left. Up to right. Down to left. Up to right. Down to left. And I'm really bad at counting, but I think one more is 5. So up to right. Down to left. Good. Face forward. Please tilt right ear to right shoulder. Good. Left to left. Right to right. Left to left.
That spot is.
That spot's the worst?
Yeah.
Okay. Right to right. Left to left. Whew. How are ya? Up to right. Sorry, right to right. And left to left. this is 3. I think this is 4.
I don't know.
Yeah.
I'm just
Hey, neither.
on the feeling.
Right to right. Go to your happy place. Left to left.
This is my happy place.
Oh, stop it, you. Good. All right. I want you to shrug your shoulders up for me, please, and slowly lower them. And up. Slowly lower. And up. Slowly lower.
You really would be good with kids.
I know, right? Girlfriend's lucky. We just finished up with Shannon today. What we didn't show on the video is the exercise for the opening up the hip. I'll leave a link in the description down below so you guys can see the exercise we did. Just because I've learned that when I do show exercise in these videos, you guys click off. Yay, YouTube analytics. But Shannon, how did you find all of that?
I loved it.
Oh,
it was a great experience. Yeah, no, the adjusting, the cracking, it was a lot.
Yeah,
I didn't expect to adjust that much, but
in the past, have you had like that much for like? I mean, I guess the main comparison point would be her neck because you've had your neck done the most before. Have you had that much go before, or like, is it just been overdue? Like,
I feel like yes and no.
Mm-hmm.
I feel like typically no. Sometimes yes, typically no. But also just like I said to you, you have a different kind of maneuver, similar but different maneuver, in which it just felt a little different.
Fair enough. No, that's very common. No two chiropractors adjust the same way. We all have our own unique spin on it, so to speak. Yeah.
And it was very comfortable how you maneuvered my neck. It was
I like that.
Sneaky too. Oh, there we go.
Oh, we're done. Oh,
yeah.
Okay, there's more. Yeah.
It's easier that way than like waiting for it and expecting it, and then you start to kind of like
tighten all
you're like
up,
trying
right?
to like just don't tense up, but like you just
if you just
there
go
done.
in there,
I'm like, okay, there we go.
Don't gotta stress
No
about it, right?
hesitation,
Sometimes I like to count. Okay, we're gonna go on 3, 1, 2, and that'll calm people down. That's good. But I'm glad you enjoyed that.
Yeah. But the upper back though, was definitely a lot. I don't know if I've ever got that much. How you adjusted that way. So the back was.
Happy to hear that. So, I mean, that's a testament to seeing somebody who's good at their craft, obviously, but we like to focus on other things here too, right? Like, I mean, we did the exercises off camera, but with, what did you think of the tools themselves? You said they were less sensitive this time, because we've done them before, but you feel like you're ready to go to bed now, kind of, don't you?
Yeah.
She just finished her coffee, too.
Yeah, just chugged down my coffee. No, I love the tools. Obviously, they're painful, but they're painful for a reason. Like, they're supposed to be painful, and it's a a good pain, right? So
it's never like this is terrible, stop.
No.
It's good pain in here, right?
Yeah. Absolutely.
Overall, you seem like you had a good experience. Is it fair to say that?
Yeah.
Good. Very happy that's the case. I'm confident that we're going to be able to help out both the sciatic pain as well as these kind of headaches that you're getting consistently. Regarding the sciatica, do the exercise we talked about prior to doing any kind of lower back intense workouts. And everything else, that's going to be largely, like, do you know what your triggers are at all? Like, have you realized what can worsen the headaches or bring one on, or are we still kind of trying to figure that out?
I feel like I have a lot of triggers.
A lot of triggers. Okay, so you know what? We can discuss those all another day. 'Cause unfortunately, we are out of time today. But do you have any other questions, comments, or concerns that you want to ask me now before we sign off for today? Don't be afraid to put me on the spot. Like, this is authentic, right?
Yeah, no.
No?
Not any questions.
Awesome.
No, I
okay,
don't
good.
think so.
Well, if you do, you know how to reach me. Okay,
Yeah.
And again, I can be reached on Instagram or via email by any of you guys. Thank you so much for coming in.
Thanks for
really
having
appreciate
me.
it, and have yourself a great rest of your day.
Thank you so much. Don't forget to like, comment, share, and subscribe.
Thank you, Shannon.